The overwhelming weight of credible scientific evidence shows that there is a direct relationship between fluoride levels in drinking water and the prevention of dental decay. Science tells us that. The first U.S. city that fluoridated was Grand Rapids, Michigan, in 1945, and the children who consumed the fluoridated water from birth had 50 to 60% less decay than before the fluoridation started. The overall effectiveness of water fluoridation in preventing the tooth decay has been established at 19 to 40%. And the scientific evidence has consistently indicated that fluoridation of community water is safe and effective for both children and adults. And community water fluoridation is the process of adjusting the natural level of fluoride in the water. All groundwater contains fluoride at some level in its natural form. The recommended therapeutic level is 0.7 milligrams per liter or 7 parts per million. That recommendation is to protect against tooth decay. It's an oral health issue. And optimally fluoridated water is not toxic and is not harmful. It makes the tooth structure more resistant to decay in children and adults, and it does it throughout the whole lifespan. A review by the U.S. Task Force on the Community Preventative Services reported that water fluoridation reduces tooth decay by 30 to 50% in children and adolescents. And a study that was published in the Journal of Dental Research in 2007 found that fluoridation prevents 27% of cavities in adults. The former U.S. General, David Satcher, in May of 2000 stated that fluoridation continues to be the most cost-effective, practical, and safe means for reducing and controlling the outcome of dental decay in a community. And as of 2008, over 72% of the U.S. population on public water systems receive optimally fluoridated water. That's 195.5 million people. And since 2000, there have been more than 310 U.S. communities in 40 states that have voted to adopt or retain their fluoridation programs. From an ethics standpoint, the U.S. courts have consistently ruled that water fluoridation is not a form of compulsory mass medication or socialized medicine. It is simply the adjustment of the natural fluoride level in the groundwater to optimum therapeutic levels to help prevent tooth decay. And in 1999, the Centers for Disease Control named fluoridation of drinking water as one of 10 great public health achievements of the 20th century. And fluoridation of community water supplies is the single most effective measure to prevent dental decay because the fluoride is incorporated throughout the whole tooth structure. More than 100 national and international health, science, service, professional organizations recognize and endorse the public health benefits of community water fluoridation for preventing dental decay. The water fluoridation in communities benefits everyone, especially those that do not have access to regular dental care. And the average cost for a community to fluoridate its water is between 50 cents and $1 per year per person in larger communities to $3 per year, $3 per year per person in small communities. And studies have shown that for every dollar spent on fluoride, it saves about $40 in dental treatment. There are literally thousands of epidemiological, clinical, socioeconomic, laboratory studies that have been conducted over the 65-year history of fluoridation of community water supplies. Those studies confirm its safety and effectiveness. This is an exceptional record, considering the torrent of criticism, the unsubstantiated scientific claims, and activist groups that have questioned this. It's come under great scrutiny. And the science has continually and consistently verified that fluoride in the water at therapeutic levels is safe and effective at greatly reducing the incidence of dental decay in the population. Now, outside of that, as a practicing dentist in an area where the fluoride content of the water on the low end is 0.9 parts per million, I don't really need the benefit of science to know how effective fluoride in the water is. I see it every day. Every day I go to work, the patients open their mouth, I see it. There is a clinically observable difference between the native West Texans, the people that have grown up there, and people who are not indigenous or native to that area. And we see the whole spectrum because we're an oil field community, and we see, especially in this economy, you know, we're seeing people from New York and Louisiana and the northern border. They're coming in to work on the oil rigs. We see migrant workers from Mexico. And consistently, when the patient opens their mouth, if I see those little white splotches, little white wavy lines that they didn't even know were there until I told them, I see a much, much lower incidence of filled, restored teeth, root canals, crowns, and it's not because they're all hygienists good. It's not because they're brushing their teeth and flossing. You know, some of them are lucky if they find the floss once a week. It's because of the fluoride in the water. On the flip side of that, the patient opens their mouth and we see fillings everywhere. We see crown, we see root canals, and I don't see the little splotchy places and the little wavy lines on the teeth. And I ask those patients, you know, where did you grow up? In Louisiana. I saw one yesterday, the exact scenario. And she said, "Doctor, I spent half my life living on sheriff when I was growing up." And it wasn't because she wasn't taking care of her teeth. I mean, she wouldn't have had all that dental work in there if she hadn't been taking care of her teeth. Her oral hygiene was good. But she had a mouthful of restorations and work that had been done, and she had no fluorosis visible in the tooth enamel. And so, you know, the difference is that we see in those scenarios, it is the fluoride in the water. That's what it is. And it works. And it's been proven. Everybody knows it.
Dr. George, we have a couple minutes remaining.
This is an issue with fluoride.
You're fine.
It's the issue that we deal with all the time in any kind of health care and any chemical that we put into our body. Any chemical, even our beneficial medications at inappropriate levels are toxic. An excellent example of this is the medication warfarin. Warfarin, that's rat poison, right? Okay, it's also a very beneficial medication that helps to prevent and treat blood clots. And over decades, we have had studies, well-conducted scientific methodology that show the benefits of Coumadin, and also that have developed the appropriate therapeutic levels. The same thing has happened with fluoride. That appropriate therapeutic levels have been studied and studied and studied. We've got 65 years worth of experience with it. And the benefits are well demonstrated with little, if any, toxic effects at the appropriate therapeutic level.
Thank you both very much.
Mary, are we allowed to ask questions?
You are, Councilmember. What I'm going to do, though, I think, is bring forward the questions we talked about in advance, just so that each side can respond to those. And then, as needed, I certainly would appreciate your interjections. So, folks, what we'll be doing from here on is allowing 2 minutes aside to respond to some questions submitted in advance by the council offices.